So as I record this video, it is springtime where I am. Flowers are blooming, the world is opening up, people are having fun. But for some people, this is something that they can never do because of allergies. Hello everyone, welcome. My name is Kwaku and I'm a pharmacist. In today's video, I am going to be reviewing the medication Zyrtec, or Cetirizine as it goes by its generic name. We're going to take a look at what it is used for. We will take a look at how to take it. We'll also take a look at some side effects and some general counseling points or some precautions that you should be aware of. Like all my other videos, this is purely for informational purposes only, and I believe you'll be better served by talking to your local healthcare professionals who know you best and can give you the best recommendations. So first off, what is Zyrtec? Well, Zyrtec belongs to a class of medications called antihistamines, and just like the name suggests, they block histamine, which is a substance that the body releases in response to coming into contact with what we call allergens, or things that the person or individual is allergic to. Now, the symptoms that happen when one comes into contact with such allergens include sneezing, runny nose, itchy, watery eyes, itchy nose, and throat. So cetirizine may be temporarily used to manage these symptoms. Now, these symptoms can be seasonal or perennial. And seasonal, as the name suggests, it only occurs during particular seasons. For example, spring, like I said earlier. And during spring, obviously, there's an increase in the pollen that is in the air. You know, I never knew pollen was such a problem until I moved into the US. You know, in Ghana, where I come from, you barely see any pollen. But after living in the States for a couple of years, sometimes you walk out of the door and your car is literally yellow from the pollen that has settled on it. So seasonally, people suffer through these allergies just because their body is reacting to the pollen. The other incident or the other scenario is perennial allergies. For some people, they have year-round allergies, which does not depend on what season there is. And such allergies are usually caused by dust in the house. Cetirizine may also be used to treat or manage redness or itching that results from hives. But from personal experience, when it comes to hives and other skin issues, I find that Benadryl tends to work better for such conditions. The only disadvantage with that one is that Benadryl is almost guaranteed to cause drowsiness in a lot of people. So sometimes, even though it may work better, it tends not to be ideal depending on the particular situation. So how do you take cetirizine? Well, cetirizine comes in three main ways, either as a tablet or chewable tablet or a syrup. It is usually taken once a day. There may be certain instances where I've seen doctors recommend that their patients take more than once a day, just because once a day is not providing them with round-the-clock protection. Ideally, it must be taken at the same time of the day. And if you're going to be using the liquid, usually that's what the kids use, it would be very advisable to use a measuring syringe instead of a teaspoon. You know, gone are the days when we used to measure medications in teaspoons. These days, it is preferred because it is more accurate. You can accurately get 5 milliliters versus using a teaspoon. I mean, teaspoons in different houses have different volumes. So 1 teaspoon in my house may definitely be very different from 1 teaspoon in your house. So ideally, use a measuring syringe anytime you're dealing with medications that come in a liquid. So what are some of the side effects of cetirizine? Before I even go into side effects, I just want to mention that cetirizine is very well tolerated. I mean, people take it. I have personally taken it. I have my family members taking it. So for the most part, most people take it without any incident. With that said, there are a few that you should be aware of. The first one is drowsiness. So cetirizine can cause drowsiness in some people. I must say that compared to some other antihistamines, like I mentioned earlier, Benadryl, cetirizine's ability to cause drowsiness is generally low. But it can happen in some people. So if you, what the recommendation is that the very first time that you take it, at least know how your body reacts to it. Take it in a home setting, don't take it and drive until you know how your body is going to react to it. In that case, then if it's okay with you, then you can just take it any time of the day. But if it causes drowsiness, then your best bet is to take it at night. Cetirizine has also been associated with excessive tiredness, dry mouth. So with dry mouth, what helps for some people is chewing sugarless gum or sucking on some hard candy, or just keeping hydrated, drinking plenty of water. Some people have complained of stomach pain, diarrhea, and vomiting. Like I said, these are very rare, and when they do, they are usually not bothersome. They just go away after a couple of days, and therefore you're able to continue taking the medication. There are some side effects though that if they do occur, you need to be reporting it to the doctor because they may signify a more serious underlying condition. And that is if you develop any hives or rash or anything like that whilst you start taking Zyrtec. This may be an indication that you are probably reacting to the medication. Other things you may look out for is difficulty in breathing, a fast or irregular heartbeat, or if there are any changes in the volume of urine, or if you find it difficult to pass urine. All these are signs that are not necessarily good, and therefore if you experience any of this while taking cetirizine, highly recommended that you talk to your doctor. It may not be anything, but I'd rather be safe than sorry and rule out any serious condition. But all in all, like I said, cetirizine is very safe. It's taken by most people, including me and my family. So I'm very confident in that medication. If you are considering it, feel free to do so. Just make sure that you report any of those serious side effects if they do occur. Thank you so much for staying through another video. I hope you found some value in it. If you did, give it a thumbs up, subscribe to the channel, and I'll catch you on the next video.